difficult draws, I know using hot water to try to bring the blood to the area.
Yes.
Is there any other tips that you would have besides if that one's not working?
That's more like the third step. So the first step, tourniquet, right? And you're palpating, right? Still not feeling, okay, give me a fist, squeeze it tight. Okay, then maybe brought it up a little bit, but if I'm still not over 80% confident in it, I'll find, okay, let me look at the other arm, do the same thing. So those would be the first step. Usually those basic steps, you get something that you're comfortable with, boom, got it. Or a little bit of redirection, boom, got it. And then my next step would be, okay, well, drop your arm. Gravity, that helps, that's nice. If that doesn't work, heat. Yes, we usually put hot water in a glove, tie it off, put it on there. Make sure it's not too hot, because obviously you don't want to burn skin. That wouldn't be very nice. And if that doesn't work, you know, just say, hey, this is my best shot, I'm going to go with it. Are you cool with that? If so, they're usually, okay, just do whatever. If most people who need that much prep, I guess you would say, are used to being a harder draw. So at that point, I do have ladies come in right away. They're like, hey, can you give me a hot glove? Sure. Oh. Or I have a lady a couple days ago came in with a rice sock.
Oh, sure.
Yeah.
Preheated.
She came, yeah, preheated, yes.
Well, you can also tell them to hydrate and come back in an hour or so.
Yeah, hydration is a huge thing. I mean, some people that have been fasting, so it's really hard. Food is a huge thing plugging up those veins too. Exercise, you know, their blood pressure, everything, all these little things added up. Behind the scenes are what make a successful or a difficult draw. And so we do our best. I mean, if we're not going to get it in 2 pokes, there's a possibility that it's just not going to happen. If they're comfortable with somebody else trying 2 pokes, that's up to them. Always give them the option, say, hey, you can either hydrate the rest of the day and into tomorrow and try it again tomorrow. There's a higher success rate, you know, if you're hydrated and do your best to prepare. Yes?
Getting on the hydration thing, at our clinic we have a lot of physicals that we do, and many of them require blood draws where the patients have to have fasting. And quite often these physicals are scheduled through a third party, and they don't always tell them what fasting means. Fasting is not eating, okay? You can still drink water, and you can still even have coffee so long as there's no sugar or cream in it. But no juice, nothing with sugar, nothing like that. But water and black coffee is, I can't, is there anything else?
Yeah. It's no caloric intake pretty much. The caffeine though, some people are, oh, I just can't live without my coffee. I go out of the pot first thing in the morning, that's all they get, you know. We want people to be as comfortable as possible, right? We don't want to completely be big old jerks, you know, and say, you know, you have to be absolutely miserable before we poke you, you know, and that's a lot of miserable preparation for those 2 minutes right there. But coffee is a diuretic, so it's going to dehydrate you. So that's kind of a, what do? You know, if you need the caffeine, but you need the water. So pretty much we say, if you need your coffee, drink double the weight of coffee in water. Pretty much. So for every cup of coffee you have 2 or more cups of water to counteract that.
And then they'll let their pants sitting in
pretty
chair,
much.
right?
Scare the blood out of them. Why not?
Well, in our clinic, our protocol, we collect the urine and then we do the blood.
Very good. Well, that's a very good one, yes.
No, we do it that way.
Yeah.
Yes.
Or we ask if you want to go before or after. Hey, maybe you need that extra little scare to scare up something, you know? Who knows? But yeah, it's 10 to 12 hours, nothing but water pretty much, unless you're going into like pre-op and surgery and stuff. If somebody specifically says do not drink water, obviously follow their direction because it's for their purpose. And so yeah, their overall health, their hydration level, that's all these different things that are going into your mind when you're about to poke somebody. you can even feel it too. Feel it in your palpations of the veins or the arms, in the skin, how it responds to your touch, their temperature. You know, if they're nice and warm and hot, the veins pop out beautifully. But folks, in the winter time it's a lot harder, because even though they're bundled up, you know, they're really cold, or they're just kind of not moving, and they're gonna poke you, okay, oh it's cold, oh it's cold, oh. And that tension, even being tensed up like that, will definitely put a on the veins, especially if you're doing capillary totes. Cold fingers don't bleed, even on anticoags. Oh, here you go, your fingers are blue, it's not gonna work. So, yeah, so there's, it's an art. I know it sounds kind of weird being, you know, somebody who's in the medical profession, it sounds kind of foo-foo saying it's an art, but it's really, there's so many different factors that people don't think about going into this one action. People don't realize that, you know, I need to know the tubes, I need to know the minimum for each of those tubes. If it's a hard draw, how can I split it up so that we can still get all the tests done? Is it going to be hemolyzed? Am I going to cause pain? Am I doing it in a good location? Is it going to cause bruising? Some people are a little touchy about their appearance, you know. Some studying geriatrics. Some folks, you know, they don't want to realize, you know, the bodies are breaking down. It's harder for, you know, for them to get around. They don't want to give up their appearance also, you know. It's so it's a big thing. Some ladies that come in, their jewelry, they're dressed to the nines, right? And then they tell me, they sit down and they say, "Don't bruise me." You know, anticoags, you don't want to.
Right.
Okay. Okay. And she's like, oh, she rolls up her sleeve. Oh, I don't know what I did there. Oh, it's so ugly. Oh, you better not bruise me. I'm like, okay. All right. You know, try to keep it together, right? You know. Yeah, no pressure, exactly. So it's also taking in how they're feeling when they come in too. I get it. They may have personal appearance issues. They may be super sick. They're not feeling good. They're not. They don't want to be there. Maybe they're scared the results are gonna bad news. You know, the big C word. You know, scares a lot of people. So that may, you know, attribute to their reaction to you, and that puts a dome of doom over the phlebotomist, and that can actually impact how well you do also. I mean, that's a lot of pressure. Somebody comes in, seeing what tests are being drawn, you can't assume what the doctor's thinking or the reasons behind it, but when it's a very specific test to a specific disease or condition, I'm hoping and praying that it's good results for these people, you know. But they're scared that it might turn out to be something, and their mental condition may affect their physical condition. You know, high cortisol levels, that's gonna affect the whole system and how well and how easy they're gonna be able to be drawn. So it's, you know, you can go on psychological, physical, all that kind of thing, all the attributes to a successful draw. But pretty much you just have to focus on, you know, what you have before you and try to push that aside, you know, and then be understanding when something maybe blows up, or when you have a highly sensitive person, you're asking about how to deal with that, you know, respect them, give them as much, you know, common courtesy as you possibly can while still doing your job, is a huge thing. And at first that was really, really hard for me. Like, I would stop and I'd cry, or I'd have to leave and be like, it's not about me, you know. They're coming in with all kinds of anxieties or previous situations that have caused bad problems or bad experiences, and they just go by that. And the victories you got to keep in your mind. When somebody comes in, oh, I'm a hard draw. I'm like, all right, challenge.
Yes.
Game on. You know, that's pretty much it. It used to be like, oh my gosh, I'm gonna make it worse. I don't want to miss, and then I miss because I'd be all like, But now I'm just like, all right, let's get this done. I'm gonna get it one poke, all right? You know,
Okay, so you can try me.
I could try, yeah.
Sometimes patients exaggerate. They say, "Oh, I'm
Yes.
very hard." They go everywhere, and it's like, "Okay, let me see." I look, and it's like they have a good vein right
Yeah.
there. It's like they just
Yeah.
scare you when they tell,
Yeah.
"I'm a hard drug."
And they may just be basing it off of the last draw, or doing 3 out of 5 draws were horrible, so they just say they're a hard stick or whatnot. So you kind of just you gotta take the day, you gotta take them as they are the day they come in. You can't just base your normally they say, okay, do you have an arm preference? Some have an actual preference just based off of their experience. Some have had a mastectomy and they had their lymph nodes removed.
Yeah.
It is physically possible to draw on that side. I would not recommend it because there is a higher possibility of infections, bacterial situations going on that's going to cause really bad harm if something were to go wrong. So you're limited. You know, you have your left or your right side, or I've had a double patient with double mastectomy. So pretty much he's like, well, I need the draw, so just do whatever you need to do. I'm like, okay. So that's another aspect of a successful draw and how you're going to choose what you're going to do and what you're going to use. Some will say, I only want you to use this arm, and they won't let you look at that arm. I said, okay, well, I'm going to be guessing if you don't let me look at your other arm. You know, and you say, hey, well, I'm not really comfortable with anything I'm feeling. May I please look at the other arm? And normally, you know, they're okay, fine. And then there's a huge big old vein over there. I'd be like, okay, that would have been successful in the first place, but okay, you know. But it's just showing I have respect for people when they have, you know, they have a preference. Say, hey, do you have a preference? If not, boom, I'll look. First time I look at it, has something great, boom, okay, done, out. If there's nothing they're incompetent in, go to the other arm. Oh, yeah, boom, oh. Well, arms first, back of the hands. I have experienced drawing current and past addicts, and they have nothing. Nothing. Their veins are hard as rock, and it's just complete scar tissue. They usually have black marks all up and down where I would normally go, or you could feel there's kind of a vein in there, but it's rock hard, and I know it's going to either roll or move or not give me anything. Lower arm, they're a lot shallower, but if you have the confidence and the feel for it, it's possible. You can have a great draw, get a lot of blood out of it, that's fine and dandy. Try to stay out of this area. It's a lot closer to arteries, a lot closer to nerves, and all that jazz, which is not fun to hit. Back of the forearm, bicep, tricep, all of this, fair game, especially when they're really, really hard draws. Addicts, I've drawn on the top of the foot, the ankle, and the back of the knee. They have a lot of soft tissue in there, it's really nice. And a lot of the veins are very close to the surface. The last addict I drew, she had just shot up in the vein that I had to draw from. She was still bleeding from it. That's kind of, you worry about your safety, but you keep it professional. And she was pretty chill. She's like, nah, I don't care how many times you that puppy, just do it. And then she's like, I'm used to needles, obviously. she laughed. She's like, obviously. And I'm like, all right, cool. So it took a little pressure off me, and it did take me 3 tries because there was just nothing accessible, and she needed maybe 5 mils. I maybe got 3, but it was still doable based off of the minimum. So I split it up into the tubes that were necessary, and just, I mean, if you know you're going to have a hard time, you may even look it up ahead of time. What's your extreme minimum to get the job done? And these tubes actually do come in smaller mils. This is a 5.0 mil. These also come in 2.5, which are very, very handy if you have 1 or 2 tests that have a very, very small minimum of serum. Put it in there. It's also better for the ratio. The additive to blood ratio is more accurate, and it's less chance of messing up the test. Especially the anti-coag tubes, the blue tops. They come in, I believe it's 2.7 and 1.5. And they have different amounts of additive in there, and they have to be a very, 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 very precise ratio of additive to blood. And those usually have a very faint mark on the tube, that you have to fill to, a minimum fill to.
So that's
So-
pretty critical to make sure you get an accurate fill.
Yes, that's very accurate, and that's where the order of tubes come in, the order of draw comes in. Also is, you have 5 mils, you have 5 tubes to fill, you know one's a critical volume, so you know you need to get that one first and make sure it's filled properly, and then do a little detective work, you know, and to split these up. A CBC needs half a mil of blood, pretty much. So there's a tiny little ring around the bottom, that's a minimum. So and you could even put it in a pediatric tube. The little micro retainers, those are 500 UL or UL. Yeah. Half a mil, pretty much, of whole blood.
I was thinking, do we want to do a little step-by-step demo?
Sure.
I don't know what's going on in your class. Are you guys doing actual blood draws?
No,
That's
Not yet.
Okay, would it be advantageous for you guys to see a step-by-step of an actual one and just kind of see what goes
And
on?
I'm serious on
I don't know what they're looking at next.
So you're volunteering to use your arm?
I already had a blood draw today and tubes of blood drawn, so I usually do things.
You want to do the
Yeah.
So, yeah, I'm a former violin drummer,
Okay.
so I have a lot of scar tissue. So that makes me a little more difficult. I don't like to have the nurse at my doctor's office do it because she usually misses,
Okay.
because I have scar tissue.
We have a volunteer here.
Well, with the harder draw, it'd be great for folks to feel that and to see what you're talking about, hard draws and scar tissue and whatnot. If I were to physically actually draw you though, I probably wouldn't want to be using this equipment, if you know what I mean.
Okay.
If I have somebody who has that background, I want all the possible equipment in front of me so that I can make the best choice possible. I would, not saying that I wouldn't miss you or I wouldn't get blood, it's just I don't want to cause you undue pain.
So, when I go to the lab, they have me first time every time. Perfect. I never have a problem. It's just that I need somebody a little more experienced than
Right.
the one that does 1 or 2 blood draws a day.
Oh, right.
You know,
That would make
but
sense, yes.
At the lab, they never miss. It's never been a problem, but it is for, people without quite that much experience.
Right. That definitely throws them off when it doesn't feel like, oh, I've never felt that before. I'm poke anyone, okay? It's
So I'll let the students try.
yeah. Feel is a huge thing of what kind of equipment you're going to, and the experience of feeling different kind of veins is great too.
Do you want to, in our lab, we have draw chairs.
Oh,
Would you be more comfortable utilizing an area that had a draw chair in it, or would you prefer?
Sure.
It might be easier for students to see.
To see too.
Yeah.
There is one thing though, it depends on the situation too. It'd be a great experience to not have
Oh,
the
right,
experience, you know what I mean?
Bed.
In a bed too, yeah, we've had to draw nursing home draws. It's 5 a.m., somebody's sleeping, they're in their bed, they're half in their chair, they're half pulling you in with them, and sometimes you're on the floor, you're on your knee, you don't have the correct equipment, but you're making the best of the possible what you have, right? So, and sometimes that'll throw somebody off, even with experience, if you're just drawing in the optimum, perfect conditions, and you're thrown into a situation that you don't have your regular stuff, that can really throw you off too, and it's higher possibility of missing or not getting the correct tubes, or dropping it and you can't reach your stuff, and that's a problem, so, yeah, it's whatever you guys wanna do, if you wanna learn if you wanna see what you
We
guys
have
wanna
this
see.
chair right here, we can do it like this. Are they going after another chair or what?
I don't know.
No.
Does that work for you?
Let's do it right here. Katie, come on up, sit down. And then you all might want to just kind of, without getting too close to space, but
Well,
just
I was
kind
gonna
of.
ask you, what is your training? Like, did you just go, like, through phlebotomy school, or did you?
I've been trained as a medical assistant.
Oh, okay.
So we got our phlebotomy training through that.
Okay.
I went through Cascade Job Corps. They did not
cool.
allow us to practice on each other.
Oh, okay.
It was a government-funded trade school.
Oh, interesting.
My teacher did not feel cool with that, letting me go draw actual patients. So we did one draw on her.
Oh,
and the vein that she had available was not a see it vein. It was a feel it vein. So I feel very fortunate in actually learning on somebody that I couldn't see, but I could feel. That has been a very strong turning point, very strong experience for me.
interesting.
Some of the newer folks are like, oh, I can't see anything. I don't really want to poke. I don't know. I've said, well, have you felt it? Have you felt? Well, look, you know. And they're kind of, I don't know. I said, well, get in there.
Right.
Get in there and touch
be
a
able to
person.
feel it.
You know.
Well, and for me, I used to be a BioLife plasma donor, so I have
Scars.
my tiny little, just because that was my,
I do
that's what I've been
have.
doing.
Yep.
Yeah, so I've got just that,
Yeah.
but I have plenty of other
You have
options.
a
But
lot
yeah,
of options.
I have lots of options.
Lots of options
so
right
it's
now.
good.
So my first step is, hi, how are ya? You know, how
Yes.
you doing? I'm looking. That's the first step. I mean, that's gonna direct me to which arm I want. If they're like, I don't care, just do whatever. I'm taking a look. She has a lot of options. If I didn't see these two veins were right here, this vein or this vein over here, I'd say, okay, you got some nice shallow ones I can work with. Got some nice shallow ones. Okay. Oh, she got juicy hand veins. She got some hand veins. You know, even, and I know it's kind of gross and awkward, but between the knuckles.
Yeah, if you
You
had
know?
to.
And that's a possibility. Obviously, you want to choose your equipment according to what you have to work with, right? But y'all can see that, right?
Yeah.
Those blue little veins there, and she's nice and warm. Sorry, my hands are cold.
I know.
She's very warm, very hydrated. They feel plump already. So that's a huge thing. So I would choose something that I don't think is going to roll away. Something that's in parallel to the sides of our arms. It's not don't let it throw you off. It's going at a wonky angle. A lot of times they have a Y coming down here, and you can't really feel the vein that's coming straight at you, like so. So this vein is already very large and fluffy. This vein is very large and fluffy, but I feel like fluffy, juicy, fluffy and juicy. Yes. So my personal choice, I would go with her left arm, and I would go with the one that I feel is surrounded by more tissue. It feels more secure. I don't think it's going to roll on me, and especially if I'm going to be anchoring it too. So it's my personal choice, you know. A lot of times you can't feel things without a tourniquet on there.
So do you want me to sit on the end, or?
Just whatever you're comfortable
fine?
with.
Oh,
This
I'm
is fine.
fine either
This
way.
is actually an okay angle. If she were
Okay.
bent any further, that might be a problem. It could hinder the blood flow. The pressure may not be just right, and it's a possible chance of going through the vein. You know, if she were to jerk, I may go too deep. You never know how they're going to react with the actual poke. So another thing to help find a vein, don't be afraid to tie it tight. If you're doing it smooth and it's going to go quickly, being tight is going to help you in the long run, and it can come off a lot quicker, especially once you get, oh man.
Yeah, I know, they're good.
So now that I'm feeling it and there's more pressure put on it, I can actually feel that it is possible that it might move. It just feels like it's, instead of being kind of flat like so, it's plumped up and there's not a whole lot of tissue holding it in place. So that's my thing, and I can kind of see that it's going in this direction already, but I will always palpate below and I will always palpate above. I will rock back and forth to feel how wide the vein is. That will help me decide what size gauge of needle that I'm going to be using, and the possibility of it moving. So I'm going to push it and pull it, push it and pull it to see if it moves. That's very helpful on elderly folks. Some have enough adipose tissue to keep it in place. You know, it's not, age isn't always the factor, the end all and be all factor of whether it's going to be a squiggly vein or not. It's how they're built, how hydrated they are, how fluffy their vein is. That's a technical term, fluffy. Write it down.
I like